Nathan, that figure of 1,000 deaths, obviously a really sad and hard-hitting number to reach.
Yeah, it's an awful milestone, isn't it? And first, let's just say our sympathies are with everyone who's lost a loved one. Each death is clearly far more than just a statistic. And yeah, thousands of people in Cambridgeshire are in mourning, so it's definitely worth remembering that. But yeah, at the start of the pandemic, this death toll was just unimaginable, wasn't it? In the first wave from sort of March through to May, we had around 350 COVID deaths, and that's likely to be much higher in reality because, of course, testing was limited back in those days. And when we talk about deaths at the moment, this is deaths within 28 days of a positive COVID test. Over the summer, things were looking relatively good. 50 deaths in the 5 months from June to November. But since then, this fast-spreading Kent variant has been a large factor in another surge in cases and deaths. It's caused this sort of second wave of the pandemic. We hit 500 deaths the week before Christmas. And yeah, here we are less than 2 months later, and it's doubled to 1,000. If it's any consolation, Cambridgeshire is the last county in the region to reach this grim milestone. But of course, that won't be any consolation to those who've lost their loved ones.
And I know, Nathan, that you've been looking quite closely at some of these figures. Which part of Cambridgeshire has been worst affected, and are things getting better?
Yeah, of course, as you'd expect, the picture does vary across Cambridgeshire. Peterborough, that's the area from Wittering to Thorney and Deepingate to Hampton Vale, not just the city of Peterborough. Peterborough has the highest number of actual deaths at 307. But when you look at the death rate per population, this is the more important thing to look at. And actually, Fenland seems to be the worst affected part of Cambridgeshire. Fenland's the only part of the county with a death rate above the national average. In Fenland, around 1 in 536 people have died after testing positive for coronavirus. And you compare that to places like Cambridge, where it's 1 in 1,580 people. So it definitely does vary across Cambridgeshire.